meeting now. And for the sake of time, we will start. Good morning, everybody. My name is James Fitzpatrick, and I am the Director of Public Policy and Advocacy at the Alzheimer's Association Desert Southwest Chapter. And I'd like to welcome you to our Know Before You Go State Day event. As you all know, State Day is Tuesday. So it's coming up. This is going to be our first virtual State Day. And we're hoping to make it as enjoyable and fun as we have in previous State Days, even though sadly, we are going to be sitting in the comfort of our own homes, offices, what have you. I'm hoping next year we'll all be able to be together at the Capitol, the way things are looking, hopefully. But State Day is just in a couple of days. And I always want to remind everybody that, like this deck of Uno cards, the Alzheimer's Association's policy and advocacy efforts is bipartisan, nonpartisan. We take the red and blue and mix it together, and it's the Alzheimer's Association's color purple. So, you know, it's important to remember that your political beliefs need to be left at the door. It's okay that you have them. Everybody has their beliefs. Nobody's beliefs are wrong. But just please remember, bipartisan is the focus to ensure that we get our advocacy efforts through the legislature. I would like to start off by showing you all a video from the highlights from last year's State Day.
I'm here at the state capitol today to advocate for Alzheimer's, and we're working on a bill, state bill number 1242, looking for $160,000 for the state health department to put questions into CDC's questionnaire that asks many questions throughout the country about health issues, dementia, and cognitive problems in people they may survey in Arizona. And in the process, that will help provide more care for these people, more awareness. It's all about awareness. Most everyone in their life is going to be affected by Alzheimer's. So education is key to helping prevent and helping find a cure for this disease.
Jean was diagnosed in July of 2016 at the age of 55, but we actually started noticing symptoms probably two and a half years before she was diagnosed. It began with pregnant pauses where she couldn't remember names, or she could think of the function, but she couldn't think of the actual name of something. Of course, misplacing things in her shoes and keys and her glasses and her cell phone. Kind of those are the common things, but it was becoming more and more noticeable, where she couldn't remember the gaps were getting longer. The pregnant pauses were definitely getting longer.
I'm Patricia, and I have Alzheimer's. And I actually diagnosed myself because I knew that there was something wrong with my body. I have always taken care of my body. I exercise, I work out all the time, and I hike, and I'm active, and I don't smoke, and I don't drink, and I still have Alzheimer's. So it was tough. It was tough getting that diagnosis. I had also worked in memory care units, so I knew what those symptoms were. And that's when I realized I have Alzheimer's. But you know what? I'm on medication now. It is a huge difference than when I was. So the earlier you get it, get the medication. It might be a little tough, you know, because some of the medications are harsh, but when you find a good one, it'll change your life. It really will, because I got some medication. It felt like a cloud was gone, and I suddenly could talk again. And it was amazing. It was really amazing. So I'm hoping that I'm able to live and still keep partying and having fun and traveling, and hopefully it will stay.
My Alzheimer's story begins quite a few years ago with a coworker. I'm a registered nurse by profession, and I worked with a nurse that husband was diagnosed with early onset Alzheimer's, and that was back in the early 1990s. And I went through the struggles that she had. We started the first Alzheimer's walk in Arizona. We did the first aid station. It was a very small then. And he passed away after about 8 years of having the disease. And then my grandfather started having symptoms and was diagnosed with Alzheimer's. And he was here in Arizona, and he passed away. His wife took care of him at home with caregivers. And 2013, my mother was diagnosed with Alzheimer's, and she was able to stay home with my dad in his care in a small town in Utah. And he tried his best to take care of her. And in this small town, there was no care homes for Alzheimer's patients. There was no secure place for her, as he was unable to take care of her anymore. And he moved her down here to Chandler to a care facility where she's receiving wonderful care. I'm her assistant caregiver, family member, and to be so care for her needs and be there for her. I've quit my job, which was a financial decision, but I believe it was the right decision because I want to be there for her and be her person. And there's so much that she needs one-on-one that they don't always get in a care facility. And the care facility, those caregivers work so hard. It's just incredible if you were to spend a day with them, how hard they work.
I think it's very important to not shy away and don't run away and don't think it's going to go away, because it won't. It's imperative that you face this head on, because time is critical. It's and there's power in knowledge, and that's one of the things that she never shied away from. She's like, I want to get to the bottom of this. We want to accomplish a lot in changing the face of this disease and what people think it is. And also, people think they know, oh, it's just memory, or it's just forgetting where, again, your keys are, but it's confusion, it's personality changes. There's so much more to this disease than what people think. And we want to raise awareness of what it really is. We're a team, yeah. When Jean was diagnosed, we got involved with the Alzheimer's Association Walk, and we started a team called Grace and Dignity, because that's how we're facing this disease, with Grace and Dignity. And she's Dignity, I'm Grace. And in the last 4 years, we've raised over $20,000 for the Alzheimer's Association Walk, and we will continue to walk until we find this cure.
For those of you that were able to participate last year, you can see that it was a crazy, crazy busy day. On Tuesday, we're expecting it to be just as busy, just a little bit different type of crazy. The one thing that you don't have to worry about is traffic, parking, or even waking up early in the morning for those of you that live in the north and those that live in the south. I am very saddened that we aren't able to meet in person, and from the conversations that we've been having with the legislators, they are as well. They really enjoyed our advocacy efforts last year. They were very, very impressed. The association does a state day a little bit different than other organizations. So, it's with great sadness, but definitely happiness that we're able to do this year in a different format. And like most things, we adapt. I do want to go over quickly what the agenda is planned for the actual state day. We do have one piece of legislation. It's SB 1126. It is a sister companion bill to the bill that we had last year. For those of you that participated in State Day, the bill that we advocated for last year died due to COVID, or as I've been saying to my executive director, it was put on life support for a year. We did get the same sponsors, Senator Gowan, who's the appropriations chair. I do want to say, as of today, well, actually, as of yesterday, the bill has crossed over to the House. It did pass the Senate Appropriations Committee, and it did pass the Senate floor unanimously. There was no opposition. So now it's in the House and just waiting to go to committee. So it's very exciting that we do have this bill and that we have Senator Gowan back. We did have another piece of legislation, but due to politics, it didn't get through committee. That's not uncommon. We have a really tall mountain that we need to climb to ensure we have a dementia-capable system. We have access to home and community-based services. We need to ensure that there is public awareness campaigns to ensure. So we're definitely having an uphill climb, but we're in the trenches and we're moving and shaking, and we're being noticed at the Capitol, which is fantastic. One of the Alzheimer's Association's strong volunteers, Carol Brown, has been working on a legislative panel. Since we can't physically go to any of the elected officials, we're trying to bring them to us. We're trying to be as creative as we can, knowing that the legislators are extremely busy. This is crossover week where the bills from one chamber go to the other and vice versa. Next week, with all of the new bills that have crossed over, it's going to be quite hectic. So we're hoping to have 4 to 5 legislators for a panel. So look forward to that. We will hear an update on facts and figures. Every year, the Alzheimer's Association comes out with facts and figures, and Katie Skvar's, the chapter's communications director, will provide an update on that, because Tuesday is the day that the new report comes out. So it's very, very exciting to learn the new stats, see what the special report is all about. So it's definitely something to look forward to on Tuesday. We will also go over effective meeting strategies. I know that this year we may not have like a whole bunch of meetings, virtual or not, just due to the situation of having next week just be a busy week at the state legislature. But we want to be able to provide everybody the information on how to have an effective meeting. And if anybody wants the opportunity, we always want to ensure that everybody has the opportunity to participate in a meeting with a legislator or legislators. And then we will hear training. We will do a exercise on storytelling. In the video that you just saw, we saw 3 individuals' different stories. Storytelling is very, very, very important in advocacy. A lot of times, the correlation between the individual telling their story and the person talking about SB 1126, the elected official is more likely to remember you telling your story in correlation to the bill. So it's really, really important. We're going to spend a little bit of time on storytelling. When we talked about the piece of legislation, said it's the same bill that we advocated for last year. Well, it's the same language, different bill number. We are asking for $160,000 to go to the Arizona Department of Health to fund the caregiver and cognitive decline modules in the Arizona Behavioral Risk Factor Surveillance System survey. This survey is the only state-specific survey out there in the whole country that is state-specific, looking at health outcomes, health disparities, health impacts. We want to ensure that we know the impact of cognitive decline on Arizona and the effect that caregiving has on individuals. So we can actually go to our legislators and say, look, this is state data. This is what's going on here. Because we do know that Arizona has the fastest growth rate of Alzheimer's disease in the country. That I don't think is going to change anytime soon. I don't know the new updated facts and figures, but it hasn't changed in the last several years. But what does that mean? And this type of data from the Behavioral Risk Factor Survey, otherwise known as BRUFIS, and we will have somebody from the Alzheimer's Impact Office from DC talk about the Behavioral Risk Factor Survey on Tuesday. But it's really important. It's already passed the Senate, which is fantastic. We're hoping that Senator Gowan, who introduced the bill, will be able to say a few words during State Day. So definitely more to come. I did send this document to everybody that has already registered. It is not something that in general you have to memorize, but I wanted to make sure that you knew what the legislation we were advocating for on Tuesday. One thing that I do want to go over is expect the unexpected. For those of you that participated in our State Day 2 years ago, you will know that everybody got there, everybody was wide-eyed, bushy-tailed, we were ready to have our meetings, and every single meeting was canceled. Luckily, we were able to figure something out so the advocates would have some FaceTime with some elected officials. You always need to expect the unexpected. We are having this day at the same time where our elected officials are working. They may be called away, they may show up late, they may cancel. It's the way that the situation is. And so, we got to roll with the punches here and always expect the unexpected. And we will figure it out as we go along like we normally do. I would like to hand it over to Katie Skavars now, the chapter's communications director, to go over some social media tips, especially as we are virtual and we can't take selfies with elected officials. Katie?
Hey, thanks, James. No, James is right. We're going to run into some issues because one key component we've always touted for successful social media posting is a solid photo, right, with our state representatives and senators, et cetera. But that doesn't mean we can't get creative in how we do it. And I actually invite your creativity in potentially, you could still do a selfie if you're meeting, because you're going to be gridded and you can stick your head again. I mean, get creative with it. It'll probably actually get more engagement perhaps this year just because of the unique setting that we're living in. So just think through that. There are some fun ways we can still get an engaging post, but kind of want to talk briefly about remembering social media, because I think we all have different degrees of comfort in various social media and different social media channels that we might subscribe to. So some of you may have Facebook, some of you may not. Some of you may have Instagram, some of you may not. Some of you may have Facebook and Instagram. It's just a variation of what you may feel comfortable on. But the key is there's not necessarily a wrong way to do social media, but there is an effective way to make our messages amplified on social media. So whichever channels you subscribe to, I just think it's really key that if you post once or 6 times that day, that you try to make your posts really personal to you, right? Use your voice, make it authentic, give a little tidbit or a reason why you're advocating. I think that's so key. And that kind of speaks to the photo situation too. So if you don't necessarily have that great engaging photo, you could use a photo you have of you and a loved one, you and your mom, you and your grandpa, you and your grandmother, whomever it might be that it links into your personal connection to the disease. So things like that. You also, at the same time, while you want to make it personal, it can be a slippery slope, because sometimes it's hard to share our stories or give a tidbit of why we're advocating that day or thanking a senator or a legislator without kind of getting really wordy. But try to keep it as concise as possible, because if once you get out, past 4 or 5 lines, it starts to get difficult for people to digest. So try to keep it concise if you can. And then of course, tag the person that would be that you're meeting with potentially, if it's a specific thank you post, that something that demands a response in a way, whether they retweet it or like it or whatever they might do to engage with your post. So obviously that's going to be easier on Twitter. And I do understand, while we love Twitter because it's very good for like a live events like this, virtual or otherwise, many of us don't have Twitter. So I do understand that. However, if you do have Twitter and you want, that is a great platform for immediacy, right? Taking advantage of the endalls hashtag and things like that, where you can trace it more easily. And I'm not sure, James, if you had included a hashtag for the event yet. And if you do, I don't want to say, did you establish one?
It's hashtag endallsAZ.
Perfect. So endalls and then endallsAZ, and then we can track those posts. And you can do those hashtags in Facebook and Instagram as well, obviously. But Twitter is just a little bit more of an immediacy platform that is a little bit more fleeting, right? It's easier to tag folks and things like that. You can also, if you choose, if you're bold and you're going through the day and you've done a couple posts and you're like starting to want to get some folks engaged, maybe even in the media, you can utilize some of the facts and figures that we'll learn that day that will be brand new, and post something on that with taking different media. And if you are interested in that at all, just let me know and I can give you handles for those folks. It's just a great way to get their attention and basically go, hey, we're doing this over here, and then get more traction as well. So, and then don't forget your call to action if there is one. So if you're thanking a legislator and wanting others to support this cause as well, include a call to action that, again, demands response, sharing of the post, and action, things like that. So as always on state days, I invite anyone that has questions or wants to run a post by me, you're always welcome to do that. James can provide you my email to do that. I'll be on it all day because, like James said, facts and figures will be out. So we'll be really, really, really active that day with a lot of great information. So yeah, if you have any questions, please, you can put them in the chat or holler them out now and I'm happy to answer.
Thanks, Katie.
You bet.
Does anybody, I know that I scheduled this for an hour and a half. I wanted to have just like a quick update for everybody. This is something that we have done every year, but not having to provide logistics on where to park. We want to save the bulk of everything for State Day because we actually get to be able to come together. So we're trying to bring the elected officials to you. We are in the process of scheduling legislative visits next week. I have informed everybody that's registered that I will send out a document on seeing what your availability is. I'm not going to send that out until tomorrow because we're still in the process of trying to finalize visits and things are getting scheduled, canceled, rescheduled. So I want to try to get as close to State Day as possible because we know we'll be scheduling visits today, tomorrow, Monday, and probably all day Tuesday as well. So we definitely are looking forward to that, but nicely we are having a lot of elected officials saying that they would like to jump into the State Day for a couple minutes and say hi, which is always welcome. If somebody has.
Yeah, Scott's asking if the governor is still scheduled to welcome us.
So yes, he's not able to come to the actual State Day, but he is going to do an official video welcome for us. We are waiting to get the video, but it seems to be a done deal. We know he has a script on what to say. So we are hoping that we get that today or tomorrow. But we did request the governor to want to attend, stop in and welcome, and got a busy schedule like all of you do. So he is planning on recording a video for us. Are there any other questions, comments, feedback? I would like to thank my volunteer State Day Planning Committee, Carol Brown, Laura Vickus, Jackie Goodwin, Lauren Blackburn, Lori Del Sol, Scott Gardner, and Janice Dinner for all of your amazing support, as well as Katie Scavars and Terry Spitz. Like I said in the beginning, we would love to all be together. At this point, you guys are all used to everything being virtual, and we're trying to make this just as good as last year, but it's going to be a different good, and we definitely look forward to seeing you all on Tuesday, bright and early at 9:30. So if you have any questions, you all have my email address. For those of you that started later, I'm James Fitzpatrick. I'm the Director of Public Policy and Advocacy. I'm the one that's blowing up all of your emails about State Day, and you all have the ability to reach out to me. Thank you for joining this meeting. I will give you back an hour and 5 minutes of your day.
Hey, James.
Yes.
Can I ask one question of the group, or maybe it's more of an opt-out? There is a potential that media may jump on and listen in or have interest just in relationship to facts and figures and State Day being a big news day for us. So if anyone is interested in doing potentially an interview, either via Zoom or via phone with potential interested media parties, please let me know, and sharing your story and why you're advocating and things like that. That might be great to have on hand so I can pull you quick. So you can just feel free to email me and James about that if you have interest in doing that. That'd be great.
And I do apologize. This slide is wrong. The date is correct. It is Tuesday, March 2nd, not Wednesday. This is the perils of recycling a slideshow that you used in prior years. So I do apologize for that. It is Tuesday, March 2nd. Don't forget to wear your purple. And we look forward to seeing everybody. Thank you so much, and have a great day and great weekend. Bye, everyone.